What I would like to do, though, just to give an overview, is that we're going to meet and discuss budgets tonight with 3 departments: Health, Council on Aging, and the School Department. And because school is the most complicated and the largest of our town budgets, we'll allow the Health and Council on Aging to go first, and then we'll ask Lisa to do her budget last, although I don't think we will take that much time with the Health and COA. They're relatively easy budgets. I think part of my, not concerns, but interest is how both the Senior Center and the Health Department are dealing with our COVID-19 situation. So just let me check to make sure we've got most of our members here.
I don't see Jim.
I don't see Jim or Brent.
Let me call Jim.
Okay, yeah. Good. We don't, there's Mike. All right. Hello, Mike.
Hey.
Okay. Jan Twomley will not be here. She has she's got a business issue she's dealing with tonight. I think we just Jim, perhaps.
I'm calling him now, Bob.
Okay.
Hello.
Hi, can you get in?
Yeah, I was on the phone with Phil, and then I just said to Phil, "Oh my God, it's 6:32. I forgot."
Okay, we're waiting for you.
Going in now. All right.
Bobby's coming in now.
Okay.
Bob, is Brett coming in?
I believe he's planning to, but he's not here yet. I just,
Okay.
Hold on a second. I just got a message from Hannah Friedman. She says she's having trouble logging in. She's trying to figure it out.
She's a text message, Bob?
It was, no, I'm sorry. She sent me an email.
Okay.
And she's trying to get in. She's on but muted as an attendee instead of a panelist.
Oh, I can bring her over.
Okay.
Anna, is that you?
Hey, I'm here. I was stuck out in no man's land.
Oh, I'm sorry. I saw a cell number, but I didn't see the name.
Sorry, for some reason, it won't let me sign in on the computer. I say start, and it keeps telling me I can't join. It either says I have to sign in to start if I'm the host or join meeting as an attendee. So I tried to join as an attendee, but it doesn't do anything. It says the meeting hasn't been started yet. So I don't know what's going on.
Okay.
That's what happened to me last time.
That's so strange. And then it tells me to enter my name, and I do, and it doesn't do anything. So I'm on the phone, so I just won't be able to. I won't be able to see and share my screen, but I can talk to folks and listen. I don't know what. I've been on Zoom all day. I don't know if my computer's just quitting. It might just be thinking I've been on Zoom too much today. I've literally been on Zoom for 6 hours, so it's probably why.
Usually I can bring people over as an attendee into being a panelist. I'm just trying to figure out why that option, I'm not getting that option from you right now.
Okay. No, so, I mean, at least I can talk to folks on the phone, at least in case anyone has a question. So,
Okay.
Okay, good. All right, then I think we're just waiting for Jim. So what I'll do is
I'm here.
You're here, all right.
Yep.
There he is. Great. Okay, then what we'll do is we'll start the meeting. And what I'd like to do is ask Meredith if she would like to go over her budget and talk about issues that are affecting the health department right now and in the future. And then we'll go to Kathy and discuss the Council on Aging. So Meredith, would you like to tell us about your budget and any issues you have or anything you'd like us to know about?
Sure, I'm just, hold on. There we go. All right, sorry. I'm still getting better about trying to do all of this. So I'm gonna try and share my screen if possible. One sec.
Excuse me, but by the way, for those, if you're looking at a budget book, it's on page 105.
Okay, so. Okay, can you guys see my presentation? That
Yes, it's up now.
Okay, perfect. All right, great, awesome. So thank you for everybody kind of getting together in the midst of this. I have to say that the health department has been quite busy lately from the COVID response. So what I kind of wanted to go briefly over is the mission statement, our current staffing structure, funding sources, highlights of FY20, some major initiatives, and then to transition into some vulnerabilities that I think we all have to be aware of going into this budget process, and also looking ahead pretty stoically at FY21. So just a brief, this is the mission statement of the health department to kind of, I'm gonna see if I can minimize. To improve the quality in life for all who live, work, and play in our community by ensuring safe environments, preventing injury and illness, while also encouraging positive physical and mental health. This is the CDC's assessment of essential public health services. The print is kind of small, so I'll just kind of blow through it a little bit. Monitor the health status to identify and solve community health problems, diagnose and investigate health problems and health hazards, inform, educate, and empower people about health issues, mobilize community partnerships, develop policies and plans that support individual and community health efforts, enforce laws and regulations, link people to needed personal health services, and assure the provision of health care when otherwise unavailable, assume a competent public health and personal health care workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health services, and research for new insights and innovative solutions to health problems. I think that for a very small department in a small town, we are doing a lot of great work around these essential public health services, particularly innovative solutions, connecting people to services. You know, we've made a really big focus on social determinants of health and kind of measuring more marginalized metrics around health and potential barriers for people to achieve their best health, and addressing those in a more thoughtful and resourceful way. So this is the current structure of the health department: town manager, followed by myself, a municipal response coordinator, which functions as the MRC coordinator, our licensed social worker that works within the crisis intervention team, and the CLEAR program, our peer recovery coach position. So you'll see kind of the breakdown. I broke it down by where the grant funding comes from for each one of those roles. So some highlights, some things that we were heavily involved with during FY20, North Suffolk Mental Health, North Suffolk Public Health Collaborative. It's the collaborative between Winthrop, Revere, and Chelsea to address public health initiatives. So alongside Mass General, Beth Israel, and a couple in North Suffolk Public Health, we came together and worked really hard on the community health needs assessment that was released back in, I think it was released in March, the findings of it. So we had 572 respondents for the surveys or interviews specific to Winthrop. Currently, the community health improvement plan is being developed to be shared. We've had the addition of a full-time peer recovery specialist within the CLEAR program. We've increased flu vaccination this year from 220 individuals in FY19 to 280 to date in to 280 to date this year. Developed partnerships with Boston University, their Metro Bridge project, and also the School of Public Health to utilize students in planning and application of public health modeling in Winthrop. Developed a hoarding procedure to decrease resource utilization, and our current project, which is the COVID-19 pandemic response. I'm gonna just see if there we go. So our major initiatives for the health department have been the CLEAR program, our crisis intervention team, academic public-private partnerships, and the COVID-19 pandemic response. That's what I'll kind of touch on as our major initiatives within my department. So the CLEAR team, I think everybody's has a fair assessment of what the CLEAR team is. It's been around for about 5 years now. It's a public health and public safety partnership. So it's a response to addiction in our community. We have a peer recovery coach that is connected to folks that have needs within addiction, whether it's resources, harm reduction, connecting to medication, providing, naloxone, supporting families, post-bereavement, or, if there's a loved one that's in active addiction. We've created a very extended network with public safety, the public schools, DCF, Harbor Cove, which is our domestic violence provider. We work with the Revere Studi office because, as we know, health issues do not stop at our borders. So we try to have regional responses. North Suffolk Mental Health, Boston Medical Center, the Suffolk County District Attorney's Office, the Suffolk County Sheriff's Department, and we're now kind of working a little bit with PARI, which is, it's a similar project to the CLEAR program. They're much more broad-based national organization now. So we've worked with them pretty much since March on providing naloxone through the COVID pandemic to folks that are continuing to use, so that they can at least be safe in their addiction. So the CLEAR team, this is who makes up the CLEAR team: peer recovery coach, 35 hours a week. The Winthrop Police Department, we have the unit comes over and we work together for 1 day a week on their shift, and a licensed mental health counselor 20 hours a week. So here are some statistics that I pulled together. We get about 10 to 15 referrals a month, and it comes through from all the sources. The primary source has been law enforcement and first responders. We do get referrals from the public schools. We get referrals from the Council on Aging. We get referrals from the Winthrop Public Housing. So out of the 10 to 15 referrals that we get a month, greater than 77 agree to connect with support. Our peer recovery coach services 20 to 25 recoveries a month, meeting with said recoveries for greater than 50 occasions, and also working directly with about 3 to 5 families a month to provide support around addiction. So upcoming for CLEAR is we found out in February that we were funded through the CDC and NACHA, which is the National Association for City and County Health Officers, to foster development of a national model on public health and public safety team response to the opioid epidemic. The amount of money that we were granted was $29,783. To do this, we're going to be using the bulk of those funds to develop assessment and evaluation tools for the CLEAR program to better capture and report our current metrics. It's a pretty archaic system of collecting our metrics, because police collect them in a certain language, fire collects them in a certain language, EMT providers collect it in a certain language. We don't have a centralized database, so that is going to be the bulk of what we're going to be doing, and then looking for gaps for some strategic planning and identification of future funding priorities. This is a joint project that we're taking on with the BU School of Public Health. And just to provide a little bit of context, so these are for this grant program. These are all of the other departments. Oh, sorry. These are all of the other departments in the country that were funded, and we were by far the smallest to get this funding. We competed against some pretty big metro areas. And so it's kind of a big deal that they're asking us to give them information on how to do public health and public safety partnerships to address the opioid epidemic to then replicate throughout the country. So luckily, this was supposed to be kind of a quick project, but we've gotten the okay that we can push it back. It was supposed to end the end of July, but now it's going to be ending in December. So I was afraid that we were going to lose this opportunity because we don't really have the capacity to do it right now. So I just got word this morning that we will be able to still participate. So crisis intervention team is to respond to situations that involve mental health crisis by connecting individuals and families to resources and address any barriers for achieving mental health and wellness. This is funded through the Department of Mental Health. We get a yearly grant of $76,581. Of that, that's how we pay our licensed mental health clinician who is with us for 20 hours a week, subcontracted through BMC's Department of Psychiatry for $42,781. It also pays the Winthrop Police Department outreach officer for 1 day a week to be dedicated to the CLEAR program and the crisis intervention team. It pays a portion of the peer recovery coach position. I think it's about 3 hours a week that it will cover. And then we have program costs of about $5,000 that we also received through this grant. So over the past year, I've focused on building relationships with local universities to innovate and learn to lead the department forward. I've created 2 strong partnerships at BU. One is the Metro Bridge Project and the other one is Collaborate Health. So to date, with the Metro Bridge Project, we've worked on addressing mental health concerns in order to do a screening tool, addressing health priorities and economic development, healthy relationships in adolescence. Prior to COVID, we were also planning for an air quality measurement study, working a little bit with the idea of doing atmospheric chemistry measurements for carbon, for nitrous dioxide measurements in town. And the other one that we're gonna do next spring is a health anthropology project with average speaking women to see how they get their health information in our town. The second program that I've been working with is the BU Collaborate Health program. So this past spring, we've done intensive projects with them about expanding the capabilities of the CLEAR program and also addressing healthy relationships in Winthrop. So what we've benefited from, particularly the BU Collaborate Health program, has been that the students that worked on the CLEAR program have developed an interactive website that once we get past COVID, we'll be able to launch that will expand the project even farther into our community. And also the students that worked on that actually submitted it to BU for a university-wide competition, and they came in second place. And they were, their prize was $950, I believe. And so they took that money and they're building the website on their own with their prize money because they felt so passionate about the project. And then with addressing healthy relationships in Winthrop, the students with this project came up with a set of deliverables that will be used for future grant opportunities. And both of these projects have been submitted for presentation at the National American Public Health Association conference this fall in San Francisco. So now we can talk about COVID. And all that has been going on with COVID. So just a very brief summary of what's been going on since March 16th. So March 16th, we opened the EOC and began functioning in incident command structure. That was also the day that we had our first confirmed case. We first it was about 5 days before this that we realized that things were going to change very quickly for our community, for the Commonwealth, and for the United States, and switched very fast into this crisis intervention mode. March 20th, as I'm sure you all will remember, is when the first death was reported here locally. And our current statistics as of 4 o'clock today were 197 confirmed cases, 14 unfortunately deceased, 107 have been recovered, 76 are currently in isolation. We've also, through my department, we've tested 114 residents of 2 separate congregate care settings that we did in partnership with the health department, Winthrop Fire, Action Ambulance, East Boston Neighborhood Health Center, and North Suffolk Mental Health. Each confirmed case is investigated for exposures and transmission risk. Contact investigations are done for those known close contacts of confirmed cases. So for every case that is confirmed, of those 197 confirmed cases, it also generates case files for each of their confirmed contacts. That's the way that we do contact tracing and tracking. In addition to being responsible for the residents of Winthrop, Winthrop doesn't have a centralized occupational health department for employees. So the health department has been tasked with also, keeping an eye on our employees and making sure that they're safe to be at work. So Winthrop Police Department, this has been Winthrop Police Department outreach officers, the fire department, and rec dispatchers have provided tremendous support, as have the Winthrop Public School nurses. The CLEAR team and the crisis intervention team have continued to respond to the needs of the residents throughout this pandemic. So just to say, I just wanted to include a few of the pictures just to highlight the resourcefulness of our community. So this was at one of the congregate care settings. They were not able to pay the National Guard for testing after their first case tested positive. So within a matter of probably 24 hours, we had pulled together a team from myself, like I said, Winthrop Fire and Action Ambulance, where we did tandem testing. It took us about 3 hours to go through and test 101 residents and staff in this building. And we were happy to say that out of all of those that were tested, 5 were reported back. And we have had, knock on wood, no additional cases within this facility in the past almost 3 weeks now. So I think the highlight of tonight, what I want to get through, is how vulnerable the health department is in the current stance and the current structure in the face of COVID and what it's done to the health department. The staffing structure is unsustainable. One public health professional for this department is just, come a few weeks from now, it's not going to be sustainable. So I'm proposing the addition of 1 full-time staff member into the department, which needs to be considered for the safety of the community. Once past the crisis phase of COVID-19, extensive mitigation efforts will be needed as we anticipate economic impacts on the community, mostly impacting those that are already vulnerable populations in our town. With the current structure, large-scale immunization efforts would cripple the department. So kind of a background as to why we're even more vulnerable than those around us. So the Commonwealth of Massachusetts does not fund local health departments. It's tasked with the municipal government. The way that the Commonwealth has proposed this for many years is to use the Determination of Need program. Also, it's called DON funding. So it's supposed to supplement local health. And what it does is when there's large healthcare organizations that, since they're nonprofit, that are functioning and not taxed in a community, when they expand, a portion of the money that they're spending on their expansion needs to then be given back to local community and population health programming. Since we do not have a large healthcare system operating in our town, we are left, we're left kind of out in the, out hanging out. So if you can see where we are and the communities around us that are DON funded, you know, some of them are at the very minimum getting upwards of $750,000 for their public health initiatives. Some of them are into the seven figures. So that is definitely a system that before COVID was being addressed for the inadequacies for public health. Back in January, I started meeting, I was put on a task force by the Commissioner of the Department of Public Health to reevaluate local health and look at regionalization efforts and the sustainability of that. So we've met once or twice. That's been put on the back burner because everybody else that's been working on that task force has been responding to COVID, much like myself. So unfortunately, we're in the same position where local municipalities are going to have to make funding decisions and prioritize based on the gaps that we're looking at for local health. So this is pretty much only a portion, but you know, I'm looking for an additional position here in the health department for about $50,000 for, you know, a bachelor's prepared health sciences or some sort of biological sciences to help with program management, data entry, emergency preparedness planning and training. Without the police department outreach officers that have been working with me through the CLEAR program, they've really sustained the CLEAR program and the crisis intervention team, which, you know, we've seen just as many people needing recovery resources and mental health support and even more mental health support through this. So they've taken that off my plate where they're kind of running the show right now and connecting people and looping me in. And, you know, thankfully they're down here at the EOC, so we talk all the time about, but if without that, the CLEAR program and the crisis intervention team would have fallen by the wayside. So also looking at compensation levels at this point, you know, our peer recovery coach gets paid $20 an hour, which has been what the pay has been since this role was created 4 or 5 years ago. So just for some perspective, entry level peer recovery coaches in surrounding communities are starting at $25 an hour. I think that you need to look at increasing the salary of the director's position to be more competitive with the demands of this position. You guys have any questions? That's it. That's all I have.
Thank you, Meredith. Are there any members on our commission that have questions for Meredith?
I have a few questions. Again, thanks so much, Meredith, for all you've been doing. It is greatly appreciated.
Thank you.
Just a couple of generic questions. You know, we have roughly 197 confirmed cases. Do you have any idea how many people have been tested? Like what the percentages of people tested versus positive results?
No, I wish I did. So what DP, so it will be very interesting to have the opportunity to give some input about what went right with the COVID response initially and what did not go right with the COVID response. And one of the things was the frameworks that DPH is working with. So they only allow me to see 100 tests at a time. So whether they're positive or whether they're negative. So no, so that's a long answer. So no,
Okay.
I don't have that capability.
That's okay. So more of a budget question then. You spoke about an additional person at the cost of about 50,000. Now, assuming we were in what used to be called a normal situation, do you still think that that would be warranted? Do you feel that that would be warranted going forward, regardless of the situation, or should be?
I do, because I think that there's going to be a lot more demands coming down to local health. And, part of what I was working on with this task force for the commissioner of the Department of Public Health was, obviously we talk about unfunded mandates and how inappropriate those are for the local government, and pushing strong that if there are new mandates coming down, they need to be funded by the Commonwealth. That's not a guarantee. Like as it stands right now, I don't have anybody that I can hand my phone to. And, I don't, it would be nice to have that opportunity to have somebody else. And I'm not saying it's not even as a skilled nursing role, because we're competing all the time with Boston. It's really hard to find a public health nurse at the local level. So I think it makes more sense to think about kind of a broad-based public health position in order to keep the costs down.
All right, and just two little questions then. First, was that your idea on the reduction of the clinical contract, that it hasn't been really needed lately? And is that something that you do not think it's needed?
Yeah, so the clinical contract, we were subcontracting out for services, but now that we have a full-time peer recovery coach and mental health clinic, that we've figured out how to have a part-time mental health clinician that's being paid through the DMH grant, then
Right.
It cut down on our need to do contract services.
Okay, and the last thing is, obviously everything's been focused on COVID now. Do we feel that we're going to have, like a surge in opioids after this is done, or is that kind of calmed down a little bit? But I'm concerned that it might ramp up.
I am concerned too. I know, I'm concerned too, and I'm concerned too, and I'm concerned that there's going to be concern for things that we can't project just yet, or like I'm really worried about the economic and mental health impacts that this is going to have on people in the long term, and how that's going to translate to their health and well-being. So whether it's that we see an increase in opioids, if we see an increase in alcohol, I'm concerned about that too.
Yeah. All right, well, thank you so much, Meredith.
Thank you.
Anybody else have questions?
Yeah, I have one quick one, Bob.
Yeah, Mike, go ahead.
Meredith, I'm looking at the medical supplies.
Mm-hmm.
And so we've been hearing for 2 months now about stockpiles and stuff.
Mm-hmm.
Should we be thinking about ramping it up?
Great question. I know, because if this, and we're hearing also too that we should anticipate whether it's a bump or another increase in the fall, potentially of this. And I do think, so we had 280 people that were immunized last year for influenza. And that was an increase. I think that we're going to see a lot more people want to get immunized for influenza this year. So we've been trying to leverage MEMA and some of the state partners to provide us with PPE, because we were really caught off guard with how, unfortunately, those of us at the local health department, and probably I think the same thing happened at the State Department, we were kind of under the assumption that when a large scale event happens, the stockpiles are going to be there. And the stockpiles were actually not there, which was disappointing. So And that's what, it's sad to think of the congregate care and the long-term care settings that we're at such a disadvantage for having PPE and how that could have changed things for them. So yeah, I mean, we are trying to stockpile currently for the fall.
Meredith, it's Karen Travis.
Hi, Karen.
I know you answered my questions yesterday about Park and Winthrop Place, but what about the other residential houses in town? The two on Pleasant Street, Morton Street, Winthrop Street. Who does the testing there, or are they not being tested?
I did. So I was in touch with the medical director for North Suffolk. She and I had talked extensively. In the few days, the days all seem to go together. I think it was about 4 weeks ago that I went out with them and we tag teamed and did, we just did one of the houses because they were in the same boat. Nobody could get testing stripped. So we were working as much as we could, and they're connected with East Boston Neighborhood Health Center. So East Boston was getting more tests, so they were able to get some from East Boston. But even still, the test kits that we got to do the Park Center, we had to go through our legislature to kind of motivate the release of the test strips to us, which was huge because we saved a lot of time that way by not having to wait. And I think that was the most important tool that we had in preventing one of the best tools that we have anyways in preventing outbreak and transmission and things like that is to know as quickly as possible about cases and being able to geographically contain it.
Okay, and just one budget question. You put this $50,000 out for this public health program manager. Is that a full-time position? Is that 35 hours a week? And is that a good number?
Yeah, so it is 35 hours a week. I'm thinking, so we also have about $8,000 for the municipal preparedness so potentially combining the two so that could either make it more marketable or alleviate the burden for the town of it.
Okay, thank you.
Just one quick question. Hi, Meredith.
Hey, Rich.
I was just curious, if we do a soft opening as far as our public buildings, do we have enough supplies for the beginning of next year, fiscal year, to satisfy the needs that are going to be placed upon you?
I think I think the biggest for the opening of the municipal buildings is going to be hand sanitizer, which I'm hoping that will, the supply chains were depleted so fast, which made it really a challenge. So I think that will be the biggest thing to keep up with. We're doing okay. We definitely need more masks. Non-surgical masks would be best, any sort of face covering. So I don't think that we're ready yet, but it's definitely been part of conversations this past week of trying to get to a better place for that.
Thank you.
Meredith, can I go back for one more question, please?
Sure.
Would it be possible, and if you could talk about the cost involved, for us to get testing for ourselves, that we have the ability to test people as this goes, as it progresses into the fall or whatever, just to keep ahead of the curve a little bit? Is it possible to do that, and what's the cost involved?
Yeah, I don't know if it's possible now because it seems like they're still restricting test kits. There hasn't been talk from the Department of Public Health of releasing them to local health, but I can check into that because I agree with you. Like, I feel like if we had the option here locally, it's a great thing. Like, the asymptomatic folks that I've talked to this week are, because when, for example, if you're working at a long-term care facility, a lot of people have been tested, just everybody gets tested, right? So we've had a fair amount of folks that have come back positive this week alone that were asymptomatic. So, you know, the face covering thing, the face covering policies and mandates that we've been doing is going to prevent all of that asymptomatic spread, is the theory. So, but knowing it too is also valuable, so that, you know, people are more diligent, that they're not, and it's not so much it's about them, but it's also about, you know, their contacts that need to be self-quarantining, because, you know, they could be spreading it and nobody even knows. I've done the majority of the 197 case investigations, and it's been fascinating to talk with people, to listen to their symptoms, and to hear how it affects people so differently. And one of the things that I really would love to do is to have an epidemiology student with me next fall as part of their practicum, to really dive into how long people were with symptoms, how long they were from the time that they were tested to the time that they tested negative again. We're having some people that are being tested multiple times in order to go back to work, that are testing positive even still, like 30 days after their initial test. The test sensitivity is changing as the technology gets better. So initially, the very first set of tests that the Commonwealth had, you had to be symptomatic. So it measures the viral load. So if the the sensitivity wasn't fabulous around viral load. So you had to have a lot of virus in you in order to test positive. Now it's getting more sensitive. So that's why we're seeing asymptomatic people testing positive, which is good. That's what we want. You know, we also, you know, want people just to take the precautions no matter what. So as soon as I can get my hands on some test kits, you know, it's almost like doing a flu vaccine, like a flu clinic, right? Like if we could, it's going to be well attended. That's the problem. So, or, you know, even just prioritizing, you know, who's tested, high risk testing, you know, things like that. I've been thinking forward to when schools open, if schools open in the fall, you know, those kids are like little bioterrorists. Like they spread disease or viruses, and they usually do not, like, they usually only less than 1% of those under the age of 19 have tested for COVID. So, so I think that they're either not carrying it or they're just being asymptomatic, is what my suspicion is. So, but it would pose interesting concerns for the teachers, which is just going to be kind of a tough thing to wrangle all of the questions and addressing all of these things. You know, it's just going to be a lot of questions and a lot of planning and a lot of safety planning around really as we start to untangle this, like really anything as we're trying to open it, you know, town hall and what our policies and procedures are going to be. And it's a lot.
Okay. Meredith, just one quick question. You referenced another position. Have you talked to anyone at town hall about that, the town manager, HR, anybody?
A bit. I'm trying to find it through grant funding, to tell you the truth. But I don't know how much more I can squeeze out of my grants at this point. And I'm really have only been focused on COVID, unfortunately.
Okay.
Bob?
Hello? Yes.
Oh, sorry, Bob, it's Anna. If I could just make just 2 seconds just to round out your question. Meredith has talked to Austin and I about this, and we are totally supportive of the needs that she's expressing. She was a great team player during the budget process. in terms of like working with us when we were asking departments to find efficiencies, knowing that she's already basically as lean as you can possibly get. She offered up, the fact that she's been finding savings from those purchased clinical services. So she even contributed that to help make sure that we didn't have to make other cuts elsewhere in the budget. But obviously the COVID-19 situation has really, as she noted, kind of raised to light that this is just completely unsustainable to expect that our public health director would handle all of these things on her own. And so we completely support what she's requesting and are looking to do whatever we can to help her in identifying resources for that one way or another.
Okay, good, thank you. It's good to know. I'm not that familiar with Zoom. There is two people that are on the chat box here. I presume they might want to ask questions. Does anybody know, do I just click on that to? Jim, you did this once last week.
I don't see any questions as of now on the chat box, though. I see the chat box open, but I don't see any questions.
Okay, I just see the number 2.
Okay.
There's nothing in there.
Yeah, I don't see it there either.
Actually,
But maybe,
guys, I think Wendy Millar has her hand up. Wendy, are you there? Did you have something? Wendy, are you there?
Yes, I am. Thank you.
Okay, Wendy, do you have a question?
I do.
Yes,
Looking at the budget, is there enough funding? Have we set aside, after looking at like the 500K that we proposed to add to the current budget? Is there enough money in the budget currently to sustain us from now until next July for the potential needs in terms of any kind of PPE, any kind of testing, staffing with the increases so that we wouldn't have to go back and vote new money in? Is there a way to include it in this budget round?
I'll take a shot if you want, Bob.
Go ahead. Go ahead.
Yeah, I don't, to answer your question, the simple answer, and I'm sure Meredith agree, is there's never enough money. But I do think we're trying to keep money for COVID somewhat separate because there will be some sort of reimbursement. And what we have been doing, Wendy, as I'm sure you know, is taking money out of stabilization to try to, and Anna might be able to shed some light on this also, is to make sure that we get absolutely everything we need. But it's hard to budget for that because I don't think we really know what we need. But I know through June 30th of this year, we will be fine. And I know there obviously is money in stabilization to help us out. But I think it's hard to budget a number that we really don't know. And if you do budget it, if we budgeted, let's say, $100,000, to do that, we would have to take it from another line item. So we would have to, hurt another budget. And this is something, not to compare it to snow and ice, but even the snow and ice budget, we budget a number that we know is usually unrealistic, but we're able to run a deficit and then we clean it up. And it's the similar thing to this, but I would like Anna to weigh in on it also.
Sure. Yeah, and I agree with Councilor Lettieri on that. That what we're doing right now, any costs that are coming up that are directly responsive to the COVID-19 situation, we are tracking those in separate accounts because we'll be seeking reimbursement. We get 75% reimbursement for certain eligible expenditures as a result of being declared a disaster. So we are tracking those separately. In terms of sort of setting aside funding up front, I agree that it's hard for us to project because this is such an evolving situation and it's been a little bit difficult. Meredith could speak to this better, but I think it's been not entirely sort of clear to us all the time sort of what resources are available to us in terms of equipment and other responsive materials. And so we're sort of kind of taking it as we can and tracking those costs and then working to report to town council on when we need additional funds in terms of what we're projecting the need would be. Since we don't really have a good sense of what is going to happen in the summer into next year in terms of what the needs would be, we aren't necessarily upfront budgeting for those costs. I think Meredith's budget right now would not accommodate those costs. So that's why we're sort of doing it as on kind of a pay-as-we-go approach to town council and seek out funds from our reserves to handle that, with the goal of having 75% of those funds reimbursed through FEMA, et cetera, when we're able to start pulling down those reimbursements.
All right, so excuse my naivete. I didn't see anything particularly throughout the budget that states anything for like an EOC center, for any kind of emergency preparedness.
Yep, so there's, we have an emergency management department, which Chief Flanagan, when the fire department does their presentation, he may be able to speak to that a little more fluently than the folks on tonight. So because the budget, under the town charter, the town manager has to present his budget before May 1st. And so we had to stop the numbers at a certain point. And so, which was very early on in the COVID-19 response. And so we sort of had to stop things. And then as we're going on, we're getting more information through this process to update it. So at that time, there is no sort of proactive funding there for a separate EOC, sort of the structure that exists right now with the EOC. We have some underlying costs that are in the budget, that are funded in the budget for like the just sort of the baseline expenditures associated to ensure that we have infrastructure that can be popped up when it's needed. But we don't have, there is no line in the budget that sort of sustains the EOC in its current trajectory. I think as we understand more from public health experts and the guidelines from the state about what's expected in terms of the response to COVID-19, those costs are constantly evolving. And so that's why we have we've had new expenditure lines created after the budget was put forward that that address the COVID-19. So when those funds are transferred, they're transferred to these special articles, which aren't sort of budgeted upfront in the budget.
Okay. I just think with all the kind of emergencies that we face, whether it's, whether it's weather or some kind of, for example, like this pandemic, I would like to be able to see somehow for that a way in the future as we start getting new income to maybe help get those things budgeted a little better. Thank you.
Okay, thank you.
Thank you.
Any other questions? Okay, then Meredith, I thank you for your excellent presentation.
Thank you.
We will now move on to Kathy Dixon.
Meredith's presentation is still on my screen. Is it on anybody else's?
It is. Stop sharing. Sorry. Let me. Sorry.
Thank you.
No problem.
Let me. Sorry. Oh, there you go. Oh gosh.
Well, I can start talking if you want.
Yeah, sorry, Kath.
That's all right.
All right, Kathy, go ahead.
All right, mine's going to be a little bit different. I'm going to give you a few statistics and a little overview of the Council on Aging, and then I'll bring you up to date with the COVID and what's going on with our department. So I'm going to start off by saying that we have 7 employees, 2 full-time, 5 part-time, and that gives us a budget for payroll of about $199,603. So we have a lot going on for that many employees. But we have currently from the federal census, about 4,000 to 4,200 seniors right now. And out of that, we have over 1,000 members of the Winthrop Senior Center. So during the course of the year, with all the programs that we have about 7,000 seniors participate. Naturally, some of them are duplicated participants, but it's a lot. We have a lot going on. We have a lot of things. So to come to this dead stop it's hard to imagine. But anyway, with that, as a side note, we have volunteers for the MRC who are calling seniors. We started with age 75 and older, and they call them every couple of weeks, every senior in Winthrop, to see if there's anything specifically that they need, if they're okay. I have children who live out of state that call all the time to just see what we can do for their parents and what have you. Getting back, sorry about that side note. So we pay Mystic Valley Elder Services $10,000 a year for the Meals on Wheels program. We have about 141 homebound seniors, and we have anywhere between 10 and 20 seniors come into the senior center every day, Monday through Friday. And they pay to have their meals there. It's the same meal. They just send it in a bigger quantity. So that, like I said, that's about 156 meals per day. Let's see. I wanted to talk about the things that we did during this year. As you know, last year when I presented, I spoke about the flood that we had, and that was major, but we had to wait for the insurance money to come in to start fixing everything. So we did end up getting the money from the insurance agent, and about 85,000 we got, maybe a little bit more because they did it in increments. They found different things and whatever. So because we got that money, we were able to replace the floors, update them with beautiful wood floors, and it's they're wood floors that can take all the traffic and the moving of chairs and the moving of tables. They're beautiful. We got new carpeting, and these things needed to be updated anyway. So it was kind of, I don't want to say a blessing in disguise because it really wasn't. We had all new walls put in, and we had new lighting put in, new furniture. We still have more money to spend. We had the intention of spending more money, but now there's not really any need for that because we're not there for deliveries and for things to be done, and for, you know, I really don't want workers in there right now. I'm trying to keep the senior center as clean as we possibly can for when we get the word that we will be going back. So I do have a capital request. It's a proposal for tree removal. I don't know if you people know that in the backyard we have flower beds, and we had community gardening for probably 5 years. And then over the past 2 years, the trees are so overgrown that there's absolutely no sun in the yard at all. So we cannot do the community garden. So my request is that we get these done, these trees taken out, and then we can come back with the community garden. The seniors love it. They absolutely love that because most of them live in places where they don't have a yard, or they might be in apartment homes and they just can't do it. Am I all over the place here? I'm sorry about that.
No problem.
There's so much information. So, you know, I wanted to touch base on the caregivers groups that we have also. We work with Mystic Valley a lot, and they very kindly send one of their employees out twice a month now. We were doing it once a month, but now it's twice a month. And she does counseling, group counseling, one-on-one counseling, totally free of charge for seniors who are either taking care of a spouse, a child, whatever it is. They need counseling one-on-one. Some of them need counseling in a group so that the camaraderie of that, it makes them not feel so alone. So that's one of the great things that I wanted to mention, because that's something that I think all of you can pass that word along, that we have that down there. And that's a great asset to the senior center. Let's see. So, I mean, I can tell you everything that goes on at the senior center, but I think you know, we have a full schedule. We have some form of exercise every single day. We have trips, we have Tai Chi, blood pressures, informational seminars. We just have a whole loaded full schedule. Now, we have nothing right now. And I'm not sure what's going to happen when we open back up. I certainly will be working with Meredith and with Austin and Anna, and we'll be planning how we're going to do it. My building probably will be the last to open up out of everyone, just because of the compromised population that we serve. And the people that work for me, except for Matt Rhodes, they also are seniors, so I've got to be careful of them too. Actually, I think I'm a senior now too. Ugh, but I am. Right, Jim?
Yes, unfortunately.
Yeah,
We both are.
right. So, you know, as I go into work every day for a couple of hours just because I want to keep up with the building and just to get out of my own house. It's nice to be down there by myself and all that. I was looking at what we're going to be able to do, and it's not going to be very many people that are going to come in there. They're not going to, we don't have the room to have it back the way it was. So, you know, this is going to be quite a thing that we're going to have to work out. And does anyone have any questions? What?
I have a question.
What? Who's laughing?
Barbara.
I have a question, Kathy.
Okay, go ahead.
All right. Well, thank you for all you do again. And I do have a question, somewhat budget related, and I brought this up at a council meeting, and just for you to think about, like you said, you probably will be the last department to open up, and
Right.
we have elections coming up in the fall. And I'd like to, and you don't have to share your thoughts now, but I'd like you to think about your thoughts about, you know, as of now, that is a voting location, and it concerns me a great deal that we would be bringing a
No,
lot
that's
of
not a
people
vote.
No, Jim,
It's not a voting.
Oh, it's not a voting location anymore. That's right. So we're
Yeah.
okay
Yeah.
now with the
Yeah.
school. Okay, so we feel good about
Yeah.
that. On the budget, so you talked, again, it's so hard with your budget because we don't know when you're going to open, I guess. But
Right.
you feel relatively comfortable with it as it is.
Yeah, I left out an important part. I'm sorry. So I do get funding from the formula grant. So the formula grant last year gave me $12 per senior citizen. So I ended up with a total of a little over $49,000. So that $49,000 pays for my 2 van drivers and the programs coordinator. Unfortunately, I'm sure that the new figure is probably not going to be $12 per person. Emmett Schmazo, who is the executive director of Elder Affairs, told us to go ahead and plan the grant like it's $12, but most likely it won't be. So, you know, that's a very tricky thing to do. That means I'm going to have to put things in there that are easy to take away. Well, with a limited budget, that's hard for me because I use the grant for a lot of different things. And there's only certain things you can use it for anyway. You can only use it if it pertains to the seniors and their well-being and their entertainment. So sometimes I twist things to make it sound like it's that, and then I send a message to Emmett and ask him if I can do it. I don't know. It's a kind of a wait and see process. The budget that I have, I can sustain myself for the next year as long as the, well, I was trying to do some figures. If it's $10 per senior, I would be able to sustain without having to ask the town for more money for personnel. If it goes below that, I'm not going to be able to pay the people that I have, that I pay on that. So we're just going to have to see what happens. As far as the lights and the electricity and the heat and all that, I'm good. I'm good with that. So.
Okay.
Kathy, it's Karen Chavez. You decreased your IT line item by $4,600. How did you do that?
Well, actually, I think, Anna, that was moved, wasn't it?
Yeah, I think I'll have to pull up my notes, but I think that there was something there that we realized didn't need to be funded. And so Kathy was very good at being a team player with us. And when I went back and said to folks, I need savings, I'm going to make you tell me every single thing that's in every single line. And I think when we went through, it was something that had been a one-time cost, I think at one point that wasn't needed anymore. Oh, you know what it was, Kathy? It was for those computers for the seniors. Yeah. And so we didn't need, it was a one-time, it was a one-time
I'm sorry,
purchase.
Karen, that slipped my mind. That's what it was. What happened was, I had that line item there for new computers, and we had just bought them. The friends got us new computers, so I didn't need to spend that money, and it just kept kind of staying there. And then I got caught this year that money was still there. So yeah, absolutely, I willingly gave that up. I need to help when help needs to be, because when I need it, I need for them to say, okay, you're a team player, here you go. If you need this, like I need the trees taken out, you know? So did that answer your question?
Yes, it did. Thank you.
Okay.
And I can't recall if the trees you're discussing are part of the capital project. Anna, do you recall? I know we talked about.
So the item, yeah, so this is, it's actually part of the maintenance reserve request for, okay. I think the total amount we don't think would be more than $4,000. We think we might be able to even do it for less than that. And it was, to deal with the issue that Kathy raised, and also just to make sure that it would be a safe gardening environment, so that folks aren't out there with overgrown trees with potential for injury.
Okay, right. Good. Does anybody else have any questions or comments for Kathy? No? Kathy, anything else you'd like to add?
No, actually, I appreciate your time, and hopefully if there's any more questions that you have, certainly you can get in touch with me with the town email, and I'll answer anything that I can.
Okay, thank you for your time. We appreciate it.
Okay, thank you.
Thank you, Kathy.
Okay, you're welcome, Mrs. Flavin, laughing at me.
You're enjoyable.
Okay, Lisa Howard, you've been patiently sitting.
Yes, thank you very much.
So I'd like you to
sure. I
over now.
Share my screen. If it lets me, it doesn't seem to be letting me. Hold on one second. Okay, little technical difficulties. Doesn't seem to be allowing me to share my screen, but I will start talking and continue to try to share. So thank you for having me tonight. And I would like to start off by saying to the group that as you're aware, it's my privilege and obligation to share with you the school's needs-based budget. This is something that last year we went through and spoke about how important it is for the school district to let the public know, as well as the town folks and the families, what the school district needs and sort of how we got there and how we determined that. So last year I walked folks through what was a zero-based budget planning system that we put in place, and we have done that again this year. I certainly am very aware of the fiscal situation that the community is in, so I want people to understand that I do fully understand it. I spend a lot of time speaking with Anna about the state of the budget, and certainly have spent the last 8 weeks looking at COVID, the impacts of COVID on the school district, as well as our community as a whole. So I do have an understanding of the forecast, but once again, it's my obligation to let you know what the school district needs, and then perhaps have a more realistic discussion about where we may be for next year. For some reason, it will not allow me to share my screen with you, but if you can bear with me for 1 second, if I could take myself off of video, I can try to reload it and see if it will work. So if you can pause me for 1 second. Okay, I'm going to try it one more time.
There you
There you
go.
go.
Yeah, this is the April one, and I wanted to share the May one, so one more second.
Okay.
I guess this isn't your first Zoom meeting, huh, Lisa?
No, I've had about 450 Zoom meetings. I feel like that's all I do is Zoom. Constantly, when I was a little kid, I got to watch Zoom. This
You're
is
dating yourself.
I know.
Don't start, Lisa. We'll all start singing.
I know. I want to Zoom, 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 a Zoom. My parents used to shut it off if I was punished. I couldn't watch it. So I'll probably, here it is. Got it. It says April, but it's actually May. So this is something that I had shared with some members of your group as well as the school committee, and it is posted on the school district's webpage as well.
Yeah, Lisa, you had given us the presentation and the budget. I don't know if it's the most current one. And I forwarded that to everybody, so everyone has had a chance to look at it.
Okay, great. So this is just the basic front page of our presentation. Just breaks down that multi-page, I think there's 32 or 25 pages in our line item budget. And so I've broken that down just in a short PowerPoint that I will buzz through relatively quickly. So as I spoke last year, we work our entire budget process and the building of the budget around our district strategy. And our district strategy ties into my goals as a superintendent, the administrator's goals, each school improvement plan, and we take all those things into consideration, and then we build the school's budget. We stick to our goals, which are part of our strategic plan, which is to provide a high quality, rigorous instruction and curriculum alignment for our students, to teach all of our students in a safe and welcoming environment, and also to continue to build professional culture in our school districts and community engagement. I'm not going to read through this entire thing, but it's exactly what I said last year, and it's about our budget approach. Certainly using our district strategy, we look at everything we have and determine what we need to keep, and then also decide from a strategic perspective what we need for the following year. And when we look at our budget, we look at every line item, but we also look at our services, and we look at mandates, both unfunded mandates and funded mandates, and incorporate all of that into the building of our budget, always keeping our eyes on our common core values, making sure that our students' emotional well-being is intact, that they're engaged in learning, and that we are preparing them for the next grade level or the next step in their life, whether that is the world of work or college or the services. So what is our challenge this year? Well, this could be about 600 paragraphs long, but really it's to look at our school district and to continue to make the effective progress towards achieving our system's goals, and how we have been able to do that with the budgets that we are afforded and continuing to be pleased with. So the recommended needs budget this year, I broke it down for you in a few days, is $23,989,083, and that is broken down into really two things that happen in schools. One, it has to do with paying the people who work here. So this is the entire school districts in a needs-based budget, what the salaries would be. We projected those salaries given in a number of ways, and it would be the step and lane changes. We did a complete scattergram of the people we have, looked at the steps and lanes. We had contract negotiations. One of the items was relative to one of the contract negotiation items that has been settled was for teachers to give us more of a better time frame when they knew they were going to be moving a lane, meaning they'd get a degree. In the past, they did not have to tell us that until the end of August. So it left us with some unknown costs in a new fiscal year. We've changed those dates so that we have a much clearer picture in March of whether or not somebody has the ability to change a lane. So there's no more surprises with that. And that has tightened up our sort of our fiscal focus, so that that's a known now for us. And then the other part is the expenses. Anything that is not a salary is an expense. Those are contracts for services, goods and materials and supplies that school districts need, and things like tuitions for special education and outside services. And that's those two items together in a needs-based budget reach the 23, close to $24 million range. I broke the budgets down by school so that you could see what each school would be spending for salaries. And you can just take a peek at that. And each central office is town hall office. And system-wide are people who work in all four of these schools. So for instance, the school psychologist would be one person who works there. We have some people in the system like technology, people who do technology for the entire school district sits in that system line. In the schools, it's your basic staff, your teachers, ESPs, custodial staff, and the like. Then I broke the budget expenses down so that you could see, other than people and staff members, what is spent in each school for those expenses. And you can tie that to the 25-page document that you received. It just sort of puts it in a summary for you, system-wide expenses and central office expenses as well. So why do we need this increase, and what would we be doing with it? You can see it in the line item budget, person by person or item by item, but this gives you a little bit of a snapshot of how it looks per school. Library media specialist, obviously additional curriculum and technology is always needed. And if that picture has become much clearer over the last 8 weeks, the importance of technology. It's also given us a chance to assess our abilities with technology, not just the technology savvy of our staff and what they know and what they're able to do, but also the management of technology use as a whole in the school district. And professional development, curriculum, and expense for contracts are part of that need. So contract services and expenses that go up or new items that we would like to be purchasing. And again, those are detailed in that line item budget for you. At the middle school, and if this looks familiar to you, you're not going crazy. These are many of the things that we asked for last year when we presented a needs-based budget. And if they're reappearing here, it's because we were unable to fund them last year. So the need for social studies teachers, certified social studies teachers in grades 7 and 8 remains there. We needed them last year, and we still do. A special education teacher is still a priority for us. A world language teacher, 3 educational support personnel. We have 0.5 math and ELA coach. That's actually 2 part-time coaching positions for our math and ELA department. Comes up to be about a half of a salary, so that's why it's reflected that way. Additional stipends for SST, which is the student support team. That's folks that are here after hours, sitting down and talking about some of our more vulnerable students that need support and creating plans for them. PBIS, which is a positive behavioral intervention system. And that is, again, a group of people who use strategies to improve student behavior, and then a stipend for a staff member to run an additional drama club. We had over 200 kids participate in our drama club last year, and we only see that as growing because we have such a fabulous drama department. Additional maintenance items that are outlined again in that line item budget, and you'll see this in each one of the buildings: additional professional development, curriculum expenses for contracts as well. On to the coming school. Again, the continued needs that we've asked for before: an additional special ed teacher for students with autism spectrum disorder. A junior custodian is sorely needed to keep up with the maintenance, which we are very in tune to, and keep track of the things that we do and the things that we don't have time to get to, that we would like to, for the upkeep of our buildings, that staff member would be needed. A 0.5 adjustment counselor. I actually need about 25 adjustment counselors for when we open the schools in September, which I'm hoping we do. But we'll stick with a half of one for now. 3 RTI staff. RTI staff are response to intervention folks. Prior to COVID-19, these probably would have fallen maybe at the bottom of the top 7 or 8 things that we're going to need around the district. With the loss of learning that is occurring, although our students are doing online work on a daily basis, there is no doubt in my mind that the children, not only in Winthrop, but in the entire world, are going to be behind. And to catch them up to where we need them to be, these are the type of folks that will do small group instruction with students in a classroom of 25 to help get them up to speed with the rest of the class. 2 years ago, or could even be 3, we reduced, because of budget cuts, an elementary teacher. And that elementary teacher, we would like that restored. Same request as last year. And the last 2, like I said, you will see for each building. Fort Banks, these are pretty much the exact same things we asked for last year. Those needs have increased and have not gone away, obviously, and we would continue to need the reading teacher, ELL, a math coordinator, RTI staff again, the custodian, and the 3 other items that each school needs. Some of the custodian and buildings and grounds needs that have been identified. Additional durable supplies, meaning supplies that only last 1 year, and the line items in the budget show that increase. So the cost of things go up, but these are not what we would consider level service needs. They are things that we believe if we had additionally, we could again add to the upkeep of the building. We did a capital improvement plan last year. We continue to build that capital improvement plan. I've provided that to the town, and Anna and I have worked closely on prioritizing that with the custodial staff, and the town has been good to us and keeps communicating with us about the top needs, and those needs flip around a little bit, and so Anna and I stay in close contact as those needs change. The district-wide needs, our school business office manager is retiring in September. We have asked for a certified school business manager. Susan can't be replaced, I can tell you that, but we do need somebody with a school business manager certification to run our school business office. So when Susan is gone, we're going to shift those, a lot of Susan's responsibilities and responsibilities of others. We're going to shift a lot of those responsibilities around and bring on a school business manager. Technology specialist, I could use 5 of them after the last 8 weeks since we've realized the amount of time we need to dedicate to technology, but we'll take 1 if we can get one. Desktop replacements for teachers in classrooms at the elementary level, Chromebook replacement and maintenance, projector. We still use projectors at the elementary level for various STEM activities, and they are, very few of them are working now, but the teachers do rely on them. We'd like to purchase some of those. And special education tuition increases. We've had a couple of pending cases since creating this presentation and working on the initial budget. Some of those have come to fruition. I do work with the PPS director, have a little bit of a background in understanding that. So we're monitoring that tuition line item every single day. Athletics, I put in here the transportation increase. There's, never-ending transportation increases. I may come back in my next life as a transportation store owner because it's something that's necessary for all schools. So a little bit of an increase for that department. These are just some of the capital requests that we have put in. We have a much larger running capital request document that we work on a monthly basis to make sure that we're staying up with our facilities. And here are just a few of them. We believe that a van for the athletics and the life skills program would reduce the overall transportation costs. If we were to receive those, then we would not obviously need an increase in the transportation line item. The projectors are on there because they are of useful life beyond 5 years, which is many of these capital items. So some of the things that you see here were also embedded in the needs budget, but to put them in two places allows us to find a way eventually, to make them a realization. Next slide, and I'm almost done. Just some noted efficiencies that we have completed this year, which are similar to some of the work we started last year. The residency protocol that we have put in place is working, and we are continuing to tweak that by moving to an online registration and re-registration process every year that a student switches schools. So our fifth grade is going to sixth grade. Next year, we'll have to re-register. Last year, our eighth graders going to ninth grade had to re-register. And this year, our kindergartners will also re-register. The purpose of that is people move and they don't tell us. And the only way for us to know where you live is if mail gets bounced back or you tell us. So now, not only do you have to register for kindergarten, we're having you register a few more times in your life here in the Winthrop Public Schools to ensure that you reside here in our community. We go over contracts continuously. The capital improvement planning and the prioritization of that has been helpful. Circuit breaker claiming and reviewing is something I happen to have a little bit of a background in again. So working with the director on maximizing that has led to us receiving some more funds from the state. And again, you can read these on your own, but one of the ones I would like to highlight is the E-rate submission and the changes that we've made in E-rate. E-rate was not being maximized here when I first got here, and quite frankly, I knew nothing about it, but had a conversation with somebody who did know a lot about it, who took a peek at what we were getting and said, I think you're missing a whole bunch of stuff. Since I have become educated on it, and Susan has worked with me on it, and I've gotten feedback from Anna Friedman on it. We have increased our E-rate reimbursement. I don't have the figure in front of me, but it's well beyond $20,000, which doesn't sound like a lot of money, but when you're dealing with the budget that we have, it is a lot of money. So those reimbursements that we get help our bottom line budget and return monies back to the community that can be put back into the budget. It's a reimbursement process in the following year. The solar panels at the middle high school, we don't know what that is going to yield, but certainly are hopeful that it is going to yield something. So that's another efficiency that's been created. And grant focus, we have been working hard to train internally some of our people to write grants. Our curriculum director has been a game changer for the school district in terms of her understanding of grants and maximizing the Title I grant. And her and Kathy Del Vento work very closely, and they're also both very good at seeking out grant funding and looking at our current enrollment and making sure our students are categorized correctly, which is a direct tie to the amount of grant monies that we're entitled to. So all of those are efficiencies. I think it's important to note that the school district does push for efficiencies and that we don't just sit back and ask for more and more. We look at what we have. We try to make arrangements to maximize anything we can and get the best bang for our buck out of our student population that we can. So overall, our FY20 allocation was $21,322,750, and the needs-based budget that we're asking for is approximately 2.6 million over that. I also think it's important, based on where we are in this community, in our fiscal situation and the impact of COVID-19, to take a look at a level service budget. which I have been doing from the start, along with Susan and my entire administrative staff, to have a sense of this is not the reality. If a needs-based budget is definitely not the reality of the community, and it's a long shot. Again, certainly it's my obligation to make sure you know what we do need and why we need it. But then the reality of life kicks in, and we understand that if that's not possible, what would a level service budget look like? The level service budget would look like a increase of 1.5 million from the FY20 school budget. A couple of other things. These were the reductions last year. So last year, we asked for a certain amount of money, and we were not able to receive that amount. And these are the things that we reduced to make sure that when we opened our doors, we were only opening them with the amount of money that was given to us from the town as a whole, our allocation. So these are the things that we cut from last year to get us to our bottom line budget of this year. So there were $413,000 in reductions last year. Closing, school closing impacts. I think it's important to note that although we weren't planning for any of this, and it certainly is not in our needs-based budget request, and is not necessarily in the level service budget request. And if it was, it would only make the level service budget request higher and the needs-based budget higher. These are some of the impacts that I believe are going to come down the line from the situation that we are currently in, that would be affecting our budget as a whole. And again, a lot of this is unknown because we're not there yet with the state or with the feds in terms of money overall, but their reduction and shortfalls for grants, we don't know how they're going to, that's going to impact, say, our Title I grants. Are those going to be reduced because monies are going to need to be focused in other areas from the state level? We believe we'll have that information, but we're being told that that may not come until after July 1. We understand the local revenue impact on the overall school budget allocation. I spent a lot of time talking with Anna and Austin about their concerns relative to the monies coming into our community. I am worried about the social emotional needs of our kids. Our kids have been out of school now for 8 weeks, which is about the average of a summer break for our kids. And it looks like by the time we return, if we return in September, it'll be 7 months since we have had our kids in front of us, if you count the summer. And that's a long time for kids not to have structure, for kids not to have FaceTime social interactions with their teachers. And we understand that we have a lot of work to do when our kids come back. It may not all be focused on English, math, science, and social studies for the first bit, because I believe we're going to have to teach kids how to go to school again. I think that may have somewhat of an impact on us financially, whether that is, social services, nursing services. Some of the information coming to us is that we may have to take student temperatures when they come back to school every day. We have 2,000 kids, so that's going to be a bit of an impact on our budget. How we do that, we're not quite sure yet, but we're all in the same boat in the state, so we're working closely with the state to see what that may look like. And again, that's part of the waiting game. So those are some of the concerns that we have. And then the last slide just gives you a picture of, again, you saw this needs-based budget already, the salary, the expenses, and the total. And I wanted just to share out with you what the level service budget would look like if you took out all of the needs that we requested in the needs-based budget, given the reality and forecast of our district. So if we were to go to a level service budget, you see the drop in salaries, $984,000 worth of requested salaries would come out in a level service budget. And our expenses, which are, and again, salaries are about 81% of the school's overall budget. So then when you go to the expenses, for a level service budget, we would drop $166,724 from the needed expenses to get us to that level service expense line. So the total for FY21 would, on a level service, would be $22,838,292. That is an increase of 1.5 million from FY19. So I know that's sort of a lot to digest. I can talk about it relatively quickly. I probably talk about it in my sleep. But that's where we're at. So I am open for questions if I can bring you guys back up on my screen. There we go. And I'm happy to take the slideshow down if that's helpful to people, or leave it up. It's up to you.
Yeah, I don't think we need, anybody else think we need it any longer?
No.
No.
And I can, this was revised a bit, Mr. Nguyen, from the one that I sent you.
Okay.
And as you know, I revised this. I revised the 25-page document about 50 times between my presentation and June 30th as things change for us throughout the school year and pretty much every day.
Okay.
So I am open for questions.
I just have this is not really a question, but I guess it's just a statement of what we're looking at. Right now, this is all subject to change. We're looking at a budget that reflects state aid from the governor's budget that came out before the COVID-19 hit. Normally, that would be the budget that gave us the least amount of state aid. And usually the House and or the Senate comes up with a better budget, and ultimately what the towns and communities get is more than the governor proposed. They haven't come up with anything yet at the state, Senate, or House level. So the budget that the town together is based on the governor's budget. And when we go through all that, we only got $128,000 of additional state aid in the governor's budget. In our increase in revenues from all sources for fiscal year 21 is only a little over $1 million, $1,080,000, $83,000, $1,083,000 for the entire town. The town manager's recommended budget for the school is $800,000 more than the current year, which it doesn't sound like a lot of money based on what your presentation just showed us, but it's about 74% of the entire available new revenue. So this is what we're looking at: is how do we find the necessary funds to support your budgets? Not that the budgets are wrong, it's just how do we do it? So that's kind of what we're faced with. That's not really a question. That's kind of just
no. And I have to be honest. I understand that, and I want people to know that I understand that, and that the school district is always grateful for the budget that they receive. I think that over the past 2 years, breaking the budget down to something that I heard from the community through all the interviews of folks that I did was the word transparency came up. Of the 250 interviews I did 2 years ago, it probably came up 200 times that folks wanted transparency in the budget, and we moved to that zero-based budget activity. And it was a great process, and it really educated a lot of our internal staff, our teachers, our administration. The bad thing about it is so transparent and so tight that there's very little wiggle room within the budget at all. And you can count every teacher, you can take every bit of professional development, tie it back to the strategic plan and the goals, and but unfortunately it's extremely tight. And I am aware of that. So part of some of the things that we have looked at deeply is the efficiencies, as many efficiencies as we could create. And I think that saved us last year. We had to cut $413,000 from the budget. I think some of the efficiencies we created helped that. We are working on that now, diligently looking at grants. It'll be interesting to see what the state comes up with, COVID monies for communities, and if that money's become available to the town, to the school district, earmarked specifically for schools. We will be on that right away, seeing how we might be able to utilize that money to offset any deficit, any allocation that we receive under a level service budget. Certainly we will have to make reductions. If we receive 800,000, then we will have to reduce 700,000 from the level service budget. We're constantly looking at ways to maneuver our grant funding. Right now, most of our grants are more than 80% salaries, which supplanting is not something that we're supposed to be doing, but you get to a point, and I think the entire state is to a point where we count on these grants to pay our salaries of our teachers. So if we took all those grants out, I believe is about $1.2 million worth of teachers that are embedded in Title I grants or special education grants that we receive from the state and federal government. I don't anticipate those grants going away, so I'm not panicked about that. But I think it's important to know that just our general budget of our 8 is 81% salaries, and there's still another $1 million floating around out there that is paying for salaries. So we'll continue to look at those grants to see how to use some of that grant money to offset if we can. We're also taking the approach, the budget forecast was definitely that we were going to have some difficulties this year. So in January, or February, I believe, February 1st, we froze the FY20 budget. And for things that were able to be frozen, things that we could hold off on buying. Not a tremendous amount of money, but certainly done knowing and listening to the forecast for FY21. And any monies that are left at the end of the school year or look like may be available. And given the COVID impact, we will certainly be using that money to purchase things that we would otherwise have to cut. That won't be people, but certainly can be things like materials and supplies, whether it be paper, curriculum that we are going to be expendable, durable curriculum that has a 1-year lifespan that we would be able to prepay. Spent a tremendous amount of time over the last 8 weeks on the phone with Jay Sullivan from the Department of Education, and he deals with the business office there. And he is encouraging and is telling us it's going to be allowable to do some things with this year's money for next year that is typically not authorized. So we're keeping very close track of that and doing our sort of getting close to the end of the year and seeing what accounts we have money left in that we'll be able to allocate to offset anything that we're not going to be able to do next year based on the appropriation of funds. So based on that 1.5 million for a level service, that figure, if our allocation is 800,000, we're going to be using that plan to try to offset. Some other things that we're planning for is turnover. So allocating turnover monies. So turnover is when teachers resign from the Winthrop Public Schools to go to work somewhere else, or if they're moving, and there could be an offset in their salary. So if somebody leaves at an $80,000 salary, we would freeze hiring on a much lower salary. So a master's degree step 1 teacher, if a master's degree step 7 teacher leaves, and making sure that that turnover savings would be reflected in the FY20 budget, because the teacher coming in would be paid less than the teacher going out. As of right now, we have only 2 teachers that have resigned from Winthrop Public Schools this year. That number typically changes. It's much lower than it has been in the past at this time, but summertime brings changes for people. So there may be some wiggle room with that, where that offset could help fill any pothole that we may have. And we have other things that we're doing, but I don't want to. That was a long way to answer your comment.
I appreciate it. That's very helpful to know all those avenues are being explored. The one thing you mentioned, though, that I found interesting is that you think that there might be the opportunity to carry over unspent funds this fiscal year into the next fiscal year?
So no, not carry over. So that hasn't been allowed yet, although for grant funding, some of the grants that we have, there is conversation about being able to carry them over. But with any unspent funds this year, we would have to spend them before June 30th on things that we would need for FY21. And those are being told to us that that's allowable. We're not allowed to carry it over past the 30th, but so we are in preparation mode right now with custodial staff and all of our principals to identify those consumable purchases that we could bulk purchase now for next year that would be allowable under the law, leaving us with a zero balance at the end of the school year.
Okay, I misunderstood. And then just, I guess, to follow up for that, and I'll let other people get involved, is given the unusual circumstances this year, the fact that basically schools have been closed, I know people are working on computer teaching and so forth. Do you see that your expenses this year are going to be less than projected in the budget? And therefore, this possibility would be helpful to be able to spend forward on things we need next year?
So to a minimum, so if folks that don't know, our salary lines will not change because all staff is continuing to work.
Mm-hmm.
So those costs right through the last day of school will continue to be the same. If there are going to be savings, potentially some electricity savings, if we're not having all the lights on, if we're not running the air conditioner in June, there could be a potential savings there. Not really sure what that will be, but it's quite possible that there will be a little bit of a savings there. People think it will save in athletic transportation. Athletic transportation is funded by user fees that our students pay that are in spring athletics. So that's the only season that was left. And that season is canceled. So it hadn't started yet. So we had no athletic user fees coming in that could pay for the transportation. That's not happening. So that's sort of a wash. And then the one area that could potentially run into a deficit is the school lunch program. And the reason behind that is we continue to, as advised by the state, offer free lunches for our students. And we have been doing that. And the average amount of students that are taking advantage of that are about between 10 and 15 a day, which is not a lot. We've done a lot of outreach to our families. The reason being is the school lunch program is funded by the total number of students that buy school lunch, as well as students who are free and reduced lunch and the reimbursement we get from the state for the free and reduced lunch students. Because we don't have students lining up to get their lunch as they typically would in the cafeteria and paying for their cheeseburger or chicken patties, which my son loves, those monies are not coming in. So, and our free and reduced lunch students, like I said, there's very few kids accepting lunch at all. So we're not going to be getting the state reimbursement for students on free and reduced lunch accessing that because the numbers are just not there. However, my guess is it won't be a large deficit, but if we save a fair amount of money in electricity, it may be offset by the overage in school lunch. But there are other, we have some maternity leaves that we have to cost out, that the coverage for the maternity leave may be less if that person didn't have sick time. So if they weren't accessing their sick days during the maternity leave. So I don't think the number is going to be huge. I don't think we're looking at anything in the $100,000 range of savings at the end of the year. But whatever we have, the plan is to use it to lessen next year's budget prior to June 30th. Okay, good. Anybody else have comments or questions?
Yes, thank you, Lisa, for the presentation, as always. I don't envy the position that you're in now or coming in September. And we look at the needs-based budget, and that's it's a 12.5% increase over last year. Now, you know, some people look at that and say that's a crazy number, but some of it is that we just haven't had the ability to fund it in the past years, and it just keeps adding up and snowballing a little bit. But it is a pretty large increase, and like Bob said, the whole town only has a little, like under 1.1 or 1.2 million. So it's a tough situation. We're all in. A couple of questions. Well, another potential savings line is probably, you know, substitutes. That probably helps a little bit too, and we'll go into savings, hopefully. Things I'm really concerned about for next year would be, and I guess none of us know how it's going to roll out, but transportation costs could skyrocket if they're saying, you know, instead of 2 buses for a football team, you might need 4, or a hockey team or whatever, you know, because of social distancing. So I get concerned about that. I do hope that in terms of capital, in terms of IT and vans and stuff like that, we might be able to help out with the SBAC money. So that hopefully will be helping, and hopefully sooner rather than later. But I do get concerned on the transportation cost a lot. Now also, you know, like you said, we might not know real numbers from the state aid, and you might know on certain grants before July 1st. Contractually, I'm assuming you have to give some sort of notice if there are any potential layoffs. Is that something, obviously, that you have a plan for, and maybe everybody gets, you know, I don't know how it works out, but you have to be prepared for that, correct?
Absolutely. And the timelines of the town's budget are sort of a nightmare for people like me. So thank you for the condolences prior to that, because the timelines are May 15th and June 1st, in which we have to notify staff that there will be layoffs. So we try not to do it as a sort of a practice, because the impact of getting a layoff notice creates poor culture, but it also, depending upon how long it goes that you can take that layoff notice away, could impact unemployment, which is an additional cost to the town. However, the planning for that has to be on my end. So we have started to develop the what ifs of the budget, because I've stayed in such close contact with Anna and Austin, and they've been very upfront with me, and knowing where we're headed overall, and listening to the governor and listening to the commissioner of education, and staying in tune with Masbo and Jay Sullivan. It's all these what ifs. What if the money comes? What if it doesn't? I can tell you that short of a level service budget, I believe there will be layoffs. How many? I don't know yet, because we're still trying to predict how much money we'll have at the end of the year. How can we offset that? I'm planning on an initial number, which may change from the town for the better or for the worse. So I have to plan those scenarios out as well. But if you're 81% salaries and the rest is expenses, there's really no place else to go. So yes, we will have to send out layoff notices. I will hopefully wait to the last minute to have to do that. Do I think that's going to be happening across the Commonwealth? Potentially, because I think everybody's in the same position. Just our budget timelines are very different than other communities. So schools appropriations are in many other communities given well before June, which helps in the budgeting process. So we'll wait to the last minute, but to date, I haven't really seen any other way around it. But again, it's a day-to-day evolving process. If the state comes up with COVID funding monies that get appropriated to school districts, we certainly will attach that to any monies that we think could offset our level service need of 1.5 million.
And just a couple other things. I know we've been talking about for years how much we all would like to see reduced class sizes. I don't think we really planned on it like this, but you know, that's going to be potentially another issue that you have to deal with. It's just crazy. Is any talk about, and I don't know, you know, you hear on TV, depending on which channel you watch and everything else, they talk about, but I think everybody kind of agrees the effects on you know, people over 60, which Now, I could say I'm just about in that category, but do you think they'll offer any sort of early retirement incentives to, you know, to maybe help you with the higher salaries leaving and to help you with, you know, the relative age of teachers and stuff like that? Is that something that's been discussed?
So, yes, it has been discussed between Anna and I, just because I thought it would, you know, certainly be a worthy discussion. In the event that we had some people that would be close to that. We are, our school district in particular, so, and by the way, I don't watch the news because it's disturbing, but I do listen to the commissioner and I do listen to the governor on my weekly calls with folks dealing with that, and Masbo as well. So there's lots of, there's a calculation that goes into early retirement that can impact the town side more so than the school side. So it's nice for us for a minute, and then the town side is impacted more. The total number, we are mostly a young group. We have a lot of young teachers. We have very few teachers that are close to retirement. So we've looked at those numbers, and when I say a very few, a handful that may be able to take advantage of it. So certainly that is something that we can look more deeply into. I just don't know if it will give us the return that would be worth the offset on the town. And Anna can probably give you more on that, but I don't know if you need more.
No, not really. I just wanted to know if it's, I mean, I'm sure everything is on the table at this stage. And that the major problem is we just don't know. We don't know what to expect.
The last thing we want to do is certainly lay off anybody because of the cost associated with layoff and the unemployment costs that go along with it. For every one person you lay off, you really need to do close to 1.5 to offset the unemployment costs. So the direct impact of layoffs is increased class size in a time where we're being told that we're going to have to socially distance. So if our class size is averaging at the elementary level 24, and we need to socially distance kids, there's not enough physical space to do that with all 24 kids in a room. Quite frankly, I can't wrap my head around the process at all. But if those class sizes bubble up to 30, which is, you know, there's no legal limit in general education on how many kids you can have in a classroom. But certainly herding kids like cattle will not allow us to be effective educational system at all. So that's the worry. I mean, we're not at a low class size now. So low class size is 18 to 20, and we have no classes that are 18 to 20 in the Winthrop Public Schools right now.
And the last thing I'll say is, are we able, I know you're saying potentially have some savings to buy some stuff for next year, but possibly to buy stuff with other resources from the town via reimbursement, like protective equipment and sanitizers, masks, maybe thermometers, scanning thermometers, whatever that you'll be able to use in the fall. Have you thought about that? And do you feel that you'll have an adequate supply?
So I've been working with the nurses, and certainly Meredith and I feel like we live together based on the EOC being right next to me and the amount of time we spend together with the chiefs. So we ordered a fair amount of PPE. We're struggling with availability right away when we first had our first closure. We definitely, depending upon what the guidance is in terms of how we'll be returning to school and what we have to do, you know, in terms of taking temperatures, wearing masks, things like that, we will have to ramp that up quite a bit. The town side getting reimbursement, we haven't had a lot of discussion about that yet, whether or not the town could help offset some of the purchases for the school, but certainly bundling services, you know, similar to collaborative education is a worthwhile plan because it's a cost savings plan, and certainly something that we will further discuss depending upon what we need to do and how much we need to purchase.
Thanks, Lisa, and thank you for the presentation.
Sure.
Lisa, it's Karen Chavez.
Oh, Karen, okay.
A couple of questions. I noticed on the Monday night agenda, you have the international students up for discussion.
Correct.
We're not even sure that they'll be able to get student visas to come back. That money is usually sent to the high school, if I'm correct. And is it used for a salary, and would that be a concern?
So first of all, to start off, I should have mentioned it before. So when we're talking about thoughts about how we're going to cover any type of a deficit, in an allocation for next year, a couple of the things that we have discussed is the increase in preschool tuition. It's a minimal increase, but it's an increase that has been approved by the school committee. An increase in the tuition for the international students was something that was put on the table by Mr. Crombie prior and myself prior to this happening. We believe that we were charging $12,000 a year to Educatious. They're the people that pay us. So the families of the international students pay Educatious, and Educatious pays the school district. The reason we get so many international students in this area is because and we did this assessment with Educatious out of curiosity, probably back in January. We charge one of the lowest amounts of money for the international students. So we charge $12,000 for a full school year. And as we were looking at increasing those fees prior to the COVID impact, we didn't want to price ourselves out, because when you price yourself out, then you will get less enrollment. So we were looking to go up to our per pupil expenditure, which is a little over 13,000, state per pupil, a little over 13,000, discuss that with Educatious. They didn't think that would be a game changer. And again, we want more kids. So the higher you go, the less likely you are to get kids. And then COVID hit. Educatious asked for a refund for kids when they left, and also, or a refund, or would we leave that money as a credit for students coming in next year? And the answer to that question was no. And not because we were being mean, but because I think we, within 2 days, I know we had our remote learning plan and remote learning activities up and online. So any student, regardless of whether you were on Waldemar Ave or whether you were in China, if you were an international student and you returned to your country, which our students did, you had access to learning. So we did not return that money. And actually next year we'll be increasing it. And what does that pay for? Yes, that pays for, they have an advisor that's assigned to them. They have to, as part of the program. And there's a stipend that we provide for our staff member to do that. Susan's telling me right now how much it is. It's a mentor. How much is that stipend? Do we know?
It's like around 2,000.
Yeah, about $2,000. And the other monies that we bring in pay the salary of, pay the salary of a staff member at the high school. So we bring in, I think last year we brought in about 75,000, close to 75,000. So that money, it gets directly utilized to offset those salaries. Do I think students are going to come back? We received 5 applications already for next year, new applications during the COVID crisis. And prior to that, I'd have to go back and look to see how many we had come in prior to that. So yeah, I think kids will still come. We count on that money. It's sort of like school choice money. The difference is we can pick and choose who we want to come in, unlike school choice, in which we can't.
And you also mentioned, I know that you were going up very moderately on the kindergarten tuition. Do you think, though, that maybe the registration will decrease because of this pandemic that's going on? People haven't had jobs for quite a while, and they won't be able to afford it?
It's possible. I mean, I think it's just preschool. So kindergarten is free kindergarten for everybody, which is another topic that has not been discussed yet with the school committee, but may come up. Right now, kindergarten in Winthrop is free. Being free allows more money to come through Chapter 70. So that's another discussion. But with the preschool, yeah, I mean, I think parents are going to panic irregardless. I'm worried about if we are open in September, how many parents are going to have their students come back to school. And then the cost of preschool, we are beneath the cost of daycare. So, and the private preschools in the community. So, but not by much, a couple of $100, I would say. So when we looked at that, we did a pretty good analysis of that when we were increasing the tuition, which was already approved by the school committee, because again, we didn't want to price ourselves out. Parents seem to like the public school experience. It's a good transition for their 4-year-olds. So hopefully it doesn't. You know, hopefully our parents bring our little guys back to school and you know, continue to send them. But yeah, I think it's going to be an impact overall, pre-K to 12.
And what about free and reduced lunch? Do you think that that will increase come September?
It may. You know, it depends upon the economy. You know, if parents are not going back to work or have lost jobs and their income status has changed, when they go to when they are here and enroll or start the school year and they fill out their paperwork requesting free and reduced lunch, you know, I would imagine we'll see an increase, because I would imagine there are people who are going to have, you know, job loss and be in a different economic state than they were the school year before.
And my last one is about the athletics, as far as user fees are concerned. Don't they usually start in August for the fall sports? Do you think a lot of kids maybe won't come out, or do you think the MIAA might not even be ready for fall sports?
Yeah, I mean, if the governor lifts the restriction on schools being in operation, MIAA, we've been following them. I've been following them closely. Matt Serino has been really good at keeping me up to date. We really wanted to get spring athletics in, you know, for our students. It's bad enough our seniors are losing out on, you know, a lot of different experiences, which we're holding out as long as we can to make sure when we make a decision that works for the kids, but also you know, is in step and toe with what the governor is allowing. And MIAA has really been doing the same thing, holding out to the last minute, wanting to get games in, rearranging schedules to get spring athletics in even a half a season. I don't know what the parents will do. I'm ready for my kid to get on the lacrosse field, like would be good, and get him out of the house. So you know, we'll be working on that as we know whether or not school's going to open. I think the 18th of this month will be telling, and in seeing what the governor does in terms of lightening the restrictions, and I think that will give us a good forecast. Do I think we'll have our summer program? I don't. You know, I don't think we'll be lifted that quickly, but hopefully we'll be back in the fall and things will continue.
Thanks, Lisa.
Sure, thank you.
Anybody else have questions or comments, Lisa? No?
Going last has its benefits.
Pardon me? Okay, all right, Lisa, we thank you so much for your time and thorough presentation, and good luck getting through this difficult period.
You know what? We have an amazing staff, parents. It's Teacher Appreciation Week, and not only do we appreciate our teachers, but boy, have our parents stepped up to the plate in a time that they have a lot going on in their own homes and their own families, and here we are asking them to support their students at such various levels. We had to remotely train our teachers to remotely train students to remotely learn. If I never hear the word remote learning again, I'll be a happy camper, but our staff has put together something that comparatively to other school districts is very strong, supports all students, is not discriminating for lack of technology. We have high tech, low tech, and no tech options out there for our students. And what we want is our students to be healthy and return to us in a healthy manner, and for our staff to return energized and ready to go. And every child will have a loss of learning. If anyone tells you that's not true, they're lying. There has to be some loss of learning. What I can tell you is we'll be ready to get them back to where they need to be and to move on to their next grade and hopefully not have to deal with this again. But if we do, we're ready.
Very good. Well, thank you. Appreciate again all your time and effort, as well as the whole school department.
Thank you.
Thank you, Lisa.
Yep.
Thank you, Lisa.
Thank you.
Okay, so that is our budget meetings for this evening. Just a couple of other things, and then we'll be able to adjourn the meeting. We have a meeting scheduled for Tuesday night with the police, excuse me, police, fire, and DPW. And Denise Quist noted that we had not included, excuse me, we had not included a couple of departments in our original section, our original schedule. So I'm going to, one is Harbor, the other was Parks and Rec. So I'm going to invite the Harbor Master to come next Tuesday with the police, fire, and DPW. We'll let him go first. And then Parks and Recs will add to one of our other meetings. The minutes that we need to approve are of April 23rd and April 30th. And we need two separate motions. Anybody make motion for April 30th?
Motion.
Second?
Second.
All those in favor say aye.
Aye.
Opposed? Okay. And then for April 30th, motion to accept.
Motion.
Second.
All those in favor?
Aye.
Aye.
Opposed? Okay. So again, we'll meet on Tuesday night. It'll be another Zoom meeting. Other than that, anybody have any comments or questions that you'd like to put out for the group discussion?
Bob, you just said Harbor Master's gonna be on Tuesday. What did you say about Parks and Rec?
I'll move them to a later meeting.
Okay,
I'll take a look at who we have
you just
scheduled.
didn't give us a date.
Yeah, I think it would be, let me just get our schedule here.
You can shoot me an email, Bob, if you like.
Probably I will, but it'll probably be the 14th.
Okay.
Okay. The other thought I had is we have scheduled meetings on the 12th and the 14th. So that's next Tuesday, Thursday. Then the 21st, which is a Thursday because the council's meeting that Tuesday. Then we need to come up with our recommendation, which maybe this year will be more difficult than it has been in the past. So we may want to work another meeting in there where we won't have budgets to discuss, but we'll have our recommendation to put together.
Yeah.
I mean, I haven't come up with a date per se, but does that work?
Yeah.
Yeah.
All right, I'll put this in an email then and come up with some dates that works for most of us. Try to get everybody there at the time. Other than that, that's all I have. Anything else you want to discuss?
I do want to just take a minute to thank WCAT and Mike Cabral for having us live for these meetings, which is something that we somehow haven't been able to always do in the past, but I think it's good for the town, it's good for the citizens. So thank you, Mike and WCAT for that.
Definitely, yes, appreciate that. Okay, that being said, then I'll take a motion to adjourn.
Motion.
Okay, second?
Second.
All right, I think we're anxious to go. All those in favor say aye.
Aye.
Bye.
Aye, noes? No. Okay, well, thank you all for your time this evening, and we'll see you.
Thank you, Carla.
Thanks, Carla.
Thanks, Carla.
Thank you, Carla, and thank you, Mike. All right.
And Mike.
Mike, thanks.
See you next week.
See you next week. Good night, everyone.